I'd like to welcome you all to the Regional Overdose Prevention Coalition webinar on harm reduction. I'm Ann Ricksecker. I'm the current chair of the ROPC. Next slide, Morgan. Here's our plan for this hour. We'll first hear from Silvana on the harm reduction continuum and some issues to consider as you're planning and providing these services. We'll then hear a harm reduction example from each of the 4 suburban counties outside of Philadelphia. And I'd like to just take a minute now to thank Vital Strategies for a grant that we received to support these 4 counties in their harm reduction efforts. I want to let you know that we will be recording this session. There is a chat room for you to pose questions. One of our executive committee members, Pam Bell, currently with the SCA in Delaware County, will be monitoring that and voicing any questions after each county's remarks, after each speaker's remarks. Next slide, please. I'm going to let this slide speak for itself. Next slide. Sorry, I thought I could do that. Okay, this provides you with our mission. Our primary activity is to convene and facilitate discussions so our region can more effectively and efficiently collaborate on addressing the needs of people affected by SUD. Some of you may have been involved with us because before COVID, we were able to organize 3 or 4 conferences a year where policymakers and government officials and providers and people from the single county authorities would be able to present on sort of really late-breaking and cutting-edge collaborative ideas. And some of you have led breakout sessions for us at those conferences and have also provided other volunteer supports for us, and we thank you. Next slide. This is a list of who you'll be hearing from today, many of whom provide leadership on our ROPC Executive Committee. As each finishes speaking, Pam will look at the chat room and raise some of the questions, and then each speaker will in turn introduce the colleague who will follow them. So I'll start. Our first speaker is Silvana Mazzella. I don't think she's probably a stranger to most of you. She is the Associate Executive Director of Prevention Point Philadelphia, and she is the founding member of the ROPC. So on to you, Silvana.
Thank you so much, everyone. So we have had now a few webinars related to the Regional Overdose Prevention Coalition's work to grow harm reduction. We've had a session on making the business case for harm reduction and another one on the continuum of harm reduction, where we discussed ways to advocate for harm reduction and make an argument and list support. And we also discussed the range of interventions that can be considered harm reduction. And now we are adding to that discussion as more harm reduction is being initiated and there are more opportunities on the horizon. And many of you were already doing harm reduction work, but you're doing much more of it the last few months. Next slide, please. So just want to quickly revisit the philosophy of harm reduction. We know that people engage in high-risk behaviors, largely related to substance use, also related to high-risk sexual practices and sex work. And the harm reduction approach is an approach to working with individuals engaging in such risk and offering them low-barrier services, education, and interventions to attempt to reduce the harms of substance use and sex work. The tenets of harm reduction involve non-judgment, empathy, empowering people by giving them education and opportunities to make safer choices. And most importantly, it's a no wrong door approach. And by this, we mean that we are going to keep the door open for people to walk in. And we are going to keep that door open as people walk out and maybe say no to services or leave services. So an example is when people walk in after a referral to drug treatment or the start of drug treatment, instead of "what happened? Welcome back. We're glad to see you." So we want people to come back as often as possible. Next slide, please. And many people say, well, why harm reduction when we do have drug treatment and medical care and other services? And all of those services are wonderful, even beyond the harm reduction continuum. And we're going to offer people everything. But we know that there are going to be people who say no to substance use treatment and medical care and other services. We know that some of those people can be converted to a maybe or a yes. And we also know that some people will never say yes, and we want to keep them alive. Next slide, please. So harm reduction also aligns with the CDC evidence-based prevention strategies for reducing overdose. And I'm not going to go through all of them because you can see them and because many of you are already implementing these strategies, but they are very well aligned with harm reduction. Next slide, please. And here's a pictorial of the evidence-based strategies, which do include, among other things, medication-assisted treatment, targeted naloxone, hospital-based MAT, corrections-based MAT, medical care, and syringe service programs. Next slide, please. And then finally, if we look at the trans-theoretical model of behavior change, we know that there are people that are not going to always be in the action or maintenance stage. And so we want to create space for people considering substance use treatment, medical care, mental health, and other services. We want to create space for people who lapse, and we want to create space for people who are strongly considering or strongly trying, but really need some extra support that we can provide. Next slide, please. And so just to revisit this continuum, overdose prevention and naloxone distribution, again, many of you, all of you are doing this. Naloxone leave behind and other first responder initiatives. We have on the horizon fentanyl testing in a lot of areas and harm reduction education, the whole gamut of reentry and diversion programs. Drop-in centers and access points, low barrier housing, which again, many of you are already doing, syringe service programs in the Philadelphia area out of our OPC, medication-assisted treatment and peer-based recovery, and then specialty medical care and testing and linkage to care for people who are actively using substances or have recently and have lived experience. Next slide, please. And so right now in the ROPC region, when we think about the 4 counties not including Philadelphia, so Chester, Bucks, Delaware, and Montgomery County, we do have testing and linkage to care programs. We do have robust overdose prevention programs and naloxone distribution, not only standard distribution, but leave behind and targeted efforts to work with people with long overdose histories. We have targeted efforts at hotels and other high traffic areas where we know there's high risk. We have very robust certified recovery support initiatives, as well as medication-assisted treatment and recovery. We have diversion and LEDI programs. We have lots of low barrier housing initiatives that are also growing. And we do have syringe sales in pharmacies for many years now. Next slide, please. And so what's on the horizon? Many of you know that there was an RFA for drop-in and special space for people with lived experience in counties with the highest rate of fatal overdoses. We hear that those initiatives are going to increase over the next year. So this is a big opportunity for counties to create specific space for people who are actively using or recently in recovery. We also have the specter of syringe collection boxes. We know that there is an issue with biohazard, and this is an opportunity for us to address that and quality of life issues. We also know that there have been around the state some executive orders decriminalizing the use and distribution of fentanyl test strips, which is critical. We also know that there is funding on the national level to support this, and we expect other counties to do things like this. We also have across the state over 135 organizations, gamut of organizations signing on in favor of SSPs in the last few months in Pennsylvania, and legislation to decriminalize syringe services. We have the drop-in center RFA coming online for the rest of the state at some point. And we have been working on a harm reduction toolkit that is a bit overdue, but it is not only a background explaining harm reduction initiatives, but a how-to with very concrete staffing, space, and funding examples. Next slide, please. And so, as we have these discussions about growing, expanding, or creating new harm reduction in the ROPC region, I just want to remind people that may be hesitant that when you grow harm reduction or take on new harm reduction, you don't need to do all of it. We don't need to do the most controversial forms of harm reduction. We know that there is stigma to developing harm reduction. But we can engage in the specific targeted harm reduction interventions that we know will meet our county's needs and support people and reduce overdose. Next slide, please. And so, as all of you are already doing harm reduction in interventions and growing more of them and considering more of them, we know that we have to look at the different audiences that we have to make arguments to. We know that we have to try to enlist supporters. We know that we have to look at some of the obvious and apparent barriers and opponents that we have and strongly consider their concerns and needs and see if we can balance all of the different support and opposition and concerns and needs to come up with interventions that support everyone. We want to look at people's self-interest, and we know that we have an opportunity to work with each individual sector that we need to do advocacy with to engage around growing harm reduction. Next slide, please. And so we can partner together. If you are new to harm reduction, you are considering the drop-in RFA, you are considering other types of interventions, know that you are not alone, know that you are doing the right thing, and anything that we do to save lives is the right thing. And sometimes that comes with a little bit of controversy and support building. We encourage people to not be discouraged and to look at the advocates that you have on this webinar and in the region and in other places, and we can point you to those other supporters. And next slide, please. And so as we embark on growing harm reduction initiatives, expanding them and targeting them more, we want to also remind people, let us work on always including people who use drugs. This includes people in recovery with long recovery, people recent to recovery, but it also includes people who are still actively using. Include the wisdom of their friends, their family, their parents, their supporters, their advocates, providers who have been affected by substance use. And let's look at the data and science. We have amazing data about the power of overdose prevention and diversion programs and syringe service programs and other interventions, and the support and involvement of advocates, people affected, people who use drugs, and pairing that with data and science and honoring people is how we are going to implement these harm reduction initiatives and grow our advocacy. Next slide, please. And always sustainability for me starts from day one with harm reduction interventions. And it also includes along the way, even as we're new to this, sharing what we have learned with others. Next slide, please. And finally, we offer ourselves as support, whether it's with this RFA or other types of initiatives you are considering, or whether it is trying to find out how to apply for funding for your harm reduction initiatives. We are here to offer support. Next slide, which is contact. All right, thank you so much, everyone.
Thank you, Silvana.
And I would like to introduce Mallory Parati, Prevention Supervisor for the Bucks County Drug and Alcohol Commission.
Thank you, Silvana, and good afternoon, everyone, and thank you for your time today. My name is Mallory Parati, and I'm the Prevention Supervisor with the Bucks County Drug and Alcohol Commission. We are the Single County Authority, or SCA, here in Bucks County. Today, I'm going to speak about our medication take-back program. As many of you are probably already aware, there are two semi-annual Drug Enforcement Agency National Prescription Drug Take-Back Day events. When on this day, residents can take their unneeded or expired medications to a collection site for safe disposal. Additionally, in all counties in the Southeast region, there are also permanent medication boxes, usually in place at a local police department, so residents can dispose of medications year-round and not just during these days. Specifically in Bucks County, our medication take-back program involves a community of stakeholders meeting throughout the year to plan. Typically, the semi-annual days include 45 to 50 sites countywide. And it cannot be stressed enough that these events do not happen without the support and partnership of our district attorney and Bucks County Police. Law enforcement partnership is essential to making take-back days a success. Since Bucks County's participation began in 2010, about 172,000 pounds has been collected to date. Take-back programs are an environmental prevention strategy, and a goal of environmental strategies is to impact both individual and community level change. Strategies are intended to establish or change community standards, codes, ordinances, and attitudes. And not only are environmental strategies considered an effective prevention strategy, this can also be considered an overdose prevention strategy. By spreading awareness and education to residents about medication take-back days and the importance of safe storage and disposal of medications, several important issues are addressed. Keeping medications safely stored in homes and safely disposed of can reduce the likelihood medications can be diverted either intentionally or unintentionally. And we know from local youth data that students do report that the easiest place to get medications not prescribed to them is from their own homes or a friend's home. Limiting or removing access to medications and reducing risk of medication misuse. And this can also include in the older adult population. Next slide, please, Morgan. As part of the medication take-back program, year-round, we include education and awareness about safe disposal and storage. We utilize the Up and Away campaign, which focuses on medication storage safety tips. And we also include the distribution of products like drug deactivation bags and medication lockboxes. Some of the successes and challenges that we've seen. So for successes, we've been able to expand our education efforts that started with just safe disposal and now include safe storage practices in homes. Data tells us that residents are changing their attitudes and behaviors because we are seeing higher total amounts collected from the permanent boxes, indicating that residents are going to permanent boxes on a more frequent basis to dispose of their unneeded medications than collecting just on our semi-annual days. We've also started the inclusion of Narcan distribution events as part of our take-back days. So for the last 3 take-backs, we've also included Narcan drive-through events at some of our sites. Some of the challenges that we're continuing to work on, we continue to work on spreading awareness. We need to reach more residents, families in particular, and we're continuing to try and change attitudes about safe storage. So instead of offering a resident a medication lockbox and their first response being, oh, I don't have any little kids at home, we really want to make sure that residents are understanding that really we need these to keep anyone safe. We're also continuing to spread education that Narcan is available and to provide education about co-prescribing. So if you're taking an opioid, you also want to make sure you have Narcan. Next slide, please, Morgan. So the last success that we want to talk about is the development of our permanent sharps disposal program here in Bucks. So we've heard for many years from residents that they need a place to dispose of their sharps. So back in April of 2021, we piloted a sharps disposal at 3 of our sites during the Take Back event. It was really well received and residents were grateful for the opportunity. We added 1 site in the fall of 2021 and collected nearly double what we collected in April. And a thank you to ROPC, Prevention Point Philadelphia, and Vital Strategies. We're going to be able to have 3 permanent sharps disposal options for residents going forward. We hope that that will be happening very soon. And so now we'll be able to have these boxes placed outside of our health departments throughout the county so that residents can dispose of their sharps on an ongoing basis. That is all I have. And when Morgan shares information with attendees, I will make sure to include links and resources for our medication take back program. And now I'm going to pass it along to Chester County and Kate. Thank you.
Good afternoon, everyone. My name is Kate Gunther-Silik. I am the prevention specialist with Chester County Department of Drug and Alcohol Services. Our department serves as the single county authority in Chester County. We provide prevention, intervention, and treatment services to Chester County residents. One initiative that is out of our department is our Community Outreach Prevention and Education Program, also known as COPE. This is our warm handoff program, which was implemented in April of 2018. I would like to turn or invite to join me, Rob Gilman. He is the program coordinator from Holcomb Behavioral Health Systems for our COPE program, as well as Christopher Brown. He is one of our certified recovery specialists who works with the COPE program as well. We are going to discuss this program today, and I couldn't think of a better person to go over this than the COPE team themselves. So Rob, I will turn it over to you.
Thank you, Kate, and thank you, everyone. We're grateful to be a part of this. My name is Rob. I am the coordinator for the COPE program, and I also have Chris.
How you doing, guys? My name is Christopher Brown, and I work with the COPE program, and Rob's my supervisor.
So we'll go through the slides, and then Chris will just very briefly speak about what it's like to be a CRS on the COPE team, and what about being a CRS makes the warm handoff program so successful. So a little bit of background. In response to the opioid epidemic, the Department of Drug and Alcohol Programs has worked to create warm handoff programs throughout the state. So the idea is to create a transition for overdose survivors from medical care or from the emergency department into getting them into substance use treatment. So the COPE team consists of CRSs, certified recovery specialists, that work to connect individuals and their loved ones who've survived an overdose directly to treatment and recovery support services. We are connected with all 5 of the hospitals in Chester County. So that's Chester County Hospital, Brandywine, Pale Wheat, Jennersville, Phoenixville. And then in June of this year, we started a pilot project to include some EMS agencies, as well as part of our referral sources. We look at our job to connect patients with as many different multiple recovery support services to help them access and sustain a long-term recovery plan. We do what we can to assist both the individual, family members, or significant others with education and resources. You can go to the next slide. Thank you. So when we receive a call from the hospital or an email from an EMS team, the CRSs attempt to get to the hospital within an hour of that referral. Of course, the pandemic did complicate things for us. So one of the strengths, I think, ultimately, one of the things that sustained us was we really did do well at figuring out how to deliver our services via telehealth or video services. So we'll talk about that briefly as well. So if the individual is agreeable to going to treatment, the COPE team then works to provide a bed-to-bed transfer directly from the hospital if possible. And we also do this regardless of insurance. So whether they have, managed care of some sort or private insurance, or if they have no insurance at all, we work along with the SCA. While we're referring, the CRSs work to provide the individual and maintain their motivation and provide support as we're trying to get them placed. If the individual is not agreeable to going to treatment, the CRS then works to provide them with support and to talk about maybe other recovery options as well. We work with both the individual and the family, and we'll also provide them a packet of resources, which we have put together along with the help of the SCA. And we'll also do a leave behind dose of Narcan as well. One of the things I think that makes our program so successful is that we will continue to follow up with these individuals if they're not interested in going to treatment immediately, and their family and or loved ones in the months following the initial engagement. Oftentimes, it'll take 2 or 3 months, but we'll get them to a place where they're willing to then seek treatment. Okay, Kate, you can move on. So when it comes to the warm handoff programs, there were different models in different counties or different areas of the state. What was chosen by the SCA here was to create one provider to respond to all of the hospitals in the county. So we have a COPE line, a phone, and also an email. And we respond 24 hours a day, 7 days a week to any overdose at any of the hospitals or an email from one of the EMS teams. Next slide, please. So in terms of our overall results, this is through data through, so this is starting April of 18 through October 31st, 2021. So this 98% essentially means of all of the people who agreed to have COPE be a part of their recovery process, 98% of them we've been able to engage in the EDs. Of those people that we've engaged, 72% of them we've connected to some kind of treatment. The vast majority of those we've gotten into inpatient treatment. I don't have that number, but I would say it's at least 60 to 65% of that overall number. Next slide, please. So one of the real strengths of our program is that we're able to build and develop relationships which really help facilitate bed searches and funding issues. So the CRSs are really good at establishing rapport with the clients. That's what makes this program so successful. We work very closely with Chester County Drug and Alcohol Services, also with CCDH at times. We've become very, very skilled at developing relationships with the hospital staff, nurses, the social workers, and also have developed a number of connections at the facilities that we use all the time in terms of marketing reps and admissions people that help to facilitate these bed searches for us, with them knowing that we're dealing with a high-risk population, people who are literally in the hospital post-overdose. Next slide, please. So what make some of the things that makes our program so successful is this idea that we continue to follow up with clients. If we can't complete the warm handoff, we will call them and stay in touch with a friend or with a family member or with the client, and do what we can to continue to encourage them to engage in some sort of recovery plan, but hopefully they eventually agree to go inpatient. Like I said, we'll also follow up with loved ones as well. One of the things that really did make enable us to make this transition was really getting skilled at doing all of these things over the phone. So engaging the client over the phone, engaging the facilities, doing bed searches, talking to funding sources, doing all of that stuff over the phone during the COVID period. And we've also developed a relationship with a SEPA. So for individuals who have multiple episodes with us, we'll often refer them to a long-term CRS as well. Some of the challenges have been acclimating new service providers and agencies with COPE. So staff turnover sometimes makes some of this a little difficult. Again, noting the pandemic, it was really difficult sometimes to get into the EDs, which forced us to figure out another way. And in the last, since June, we've been averaging 40 to 50 calls monthly, which is like about a 10 to 15, maybe even 20% increase over the months prior. And then lastly, one of our biggest challenges are the individuals with multiple overdose episodes and high acuity, both for mental health and for drug and alcohol. And just real quickly, I'll let Chris speak just about what he thinks in terms of being a CRS and what makes our program so successful.
Hey guys, again, my name is Christopher Brown. I work for COPE, and I love what I do. I went through a lot of ups and downs in life period, and the things that I've went through, the things that my family have gone through, I can now use that experience to help people that I'm meeting with in these ERs. It's hard to explain unless you're actually there to see what really happens. And 90% of the time, once I get there and talk with the individual, 10, 15 minutes into that conversation, we start talking about going inpatient, and it's a lot easier for me to talk to him just because I understand. And normally, well, actually all the time, anytime I give advice to anybody, it's not really advice. I'm just telling them what I did to get through that. And if I didn't live through it and I don't have the experience, then I don't give the advice. I go by what I've been through and my experience. The one thing about this program, as I've been working with COPE, I've been able to meet more people at the ERs. Slowly, more and more people that we meet, the bigger team I feel like we have. We all are working together, and we're really getting these people to the services they need, whether that be outpatient or inpatient. And I truly believe we're making a difference. I know me for one, I feel truly blessed to be a part of the program. Well, thanks for letting me talk, guys.
Thank you.
Thank you so much to Rob and Chris for sharing about our warm handoff program. That concludes for Chester County, and we are going to turn it over to Joelle from Delaware County's Department of Human Services. Thank you.
Hi, good afternoon. My name is Joelle Williams, and I am a case management specialist at the Delaware County SCA, and I am here to talk about one of our prevention programs, harm reduction programs, I should say, for Delaware County, and that is the Finally Home program. So the Finally Home program is designed to connect individuals and their families to a safe and secure, stable housing. So we work with individuals who have an opioid use disorder or a stimulant use disorder and try to get these individuals into housing. They face a lot of barriers trying to get into housing. So that's one of the things we try to overcome by at least getting them into stable housing. And this program is funded through the state opioid response for SOR2. And as I said, the clients have to be diagnosed with an opioid use disorder or a stimulant use disorder. And the stimulant use not only is methamphetamines, it's cocaine and crack or crack. They have to be homeless or at immediate risk for homelessness, or they can be in a recovery house. or temporary shelter, temporary staying with friends, which we call couch surfing. Next slide. So the Finally Home program, we started it about August of 2019. We started taking applications. Since then, we have enrolled over 70 participants in the program and got them in housing. And all our participants receive case management services through the SCA contracted providers, Community Action. Next slide. So in order for the clients to receive services or get into this program, the applications have to be submitted by a provider, a service provider, which could be their case manager. It could be a therapist or a counselor. It also could be, if they're staying in a recovery house, the house manager. All applications are submitted to the SCA at this email address, our SCA auth's email box. I review them and make sure everything that they have, everything they need is in the application. And if they don't have it, I reach out to the provider and have them submit it. After everything's been received, I send it to Community Action. The other thing we have is with this program is they have to be a Delaware County resident, or they have to be connected to Delaware County in some way. A previous address, medical assistance, maybe on probation or parole, and they can't leave the county, which is one of the ways they can get in. Other than that, send it over. Next slide, please. So I am going to introduce you to Talia Baldini. She is the program manager for Finally Home. She runs the program. She does a great job, and I'm going to turn it over to her now.
Thank you so much, Joelle, and good afternoon, everyone. Thank you for inviting me to speak today. So as Joelle said, I am the program manager for the Finally Home program. I work at Community Action Agency of Delaware County in Booth Wynn, and we just some additional items regarding the Finally Home program and what we provide. We provide assistance with locating affordable housing. So our housing stability counselors are in constant communication with landlords, property owners, property managers, leasing agents in the area to try to locate safe and affordable housing that we can kind of help move them into. We engage in an overall assessment of the housing need. So as Joelle from the SCA sends me the application, I am able to go through them, contact the applicant, and make sure that they are appropriate for the program. And we can engage in an intake and develop that housing stability plan, which gets updated every 3 months, which is super important. We like to work on budget development and planning through weekly case management services. It's super important to kind of keep up to date and in communication with their treatment provider. While we strive to obtain housing, we also want to make sure that we are also continuing to encourage their continued sobriety. The Finally Home program is able to provide move-in costs. So we provide first month's rent and double security for the unit, and then up to 5 additional months of rent. We are able to assist with transportation needs. If a client needs bus passes or SEPTA keys in order to get to and from work, or if they need to go visit a unit for a walkthrough, we're able to support in that way. And then one of the great things that a lot of landlords appreciate is that we engage in that landlord-tenant mediation. So we're not done with the client as soon as once they get housed. We stay with them for a full 12 months, and any kind of issues or questions, anything that they may need we're able to kind of assist with, which the landlords really tend to appreciate. Next slide, please. So these are just some of the responsibilities of the participants coming into the program. So the employment piece, so the individual, the participant must be either working or able to work, willing to work. Because after we try to, the hope is that after the subsidy ends, they are able to continue affording the, the unit that they were placed into. So employment and income is a requirement and a responsibility of the participant. They are required to follow all of their treatment recommendations, whether this is IOP, OP, AA, NA. It does not have to be medication-assisted treatment, MAT. Most of our clients or participants are receiving MAT, but it is not a requirement. They need to be actively working towards their housing goal, participate in case management, and communicate regularly with their housing counselor. Super important for our participants to report any changes in the household income and family dynamics, because that changes, how much we can pay or assist with their rent. And then they are, of course, also required to pay their monthly portion of the rent on time and present us with that confirmation of payment. Next slide, please. All right. So again, regarding the obstacles and just overall some of the barriers that we've noticed, an overall lack of affordable housing in Delaware County. The housing market is just, it's not great for renters. So that's one of our biggest barriers. The housing that is available, with it being up to code, safe, or meeting the housing quality standards. We found difficulties finding landlords that are willing to accept third-party payments. Some of them just aren't willing to do that. So that's been troublesome. Housing units, the ones that we have found available, have been tending to exceed that fair market rent. So with our funding source, with the grant, we're not able to accept any units that are over that fair market value. A lot of our participants have a criminal history, so working with them with that. And then a lack of legal income. So a lot of landlords want to see, documented income on the books. So for those participants who are being paid under the table, it gets a little tricky. So again, through the help of the Finally Home program, we do strive to promote self-efficacy. This is why the relationship is so important, and the continued communication with the participant and the housing stability counselor. We try to outline the responsibilities of the participant early on in the process of entering the program. Excuse me. And this allows us to promote and foster an overall sense of self-determination. And with that, I would like to introduce Neda Saltani, and she is the Overdose Data to Action Coordinator with Montgomery County Department of Health and Social or Human Services.
Hello, my name is Neda Sultani, and James, Harold, and I will be talking a little bit about one of our diversionary programs within our county. Next slide, please. So we are going to be talking about Operation Rebound. Operation Rebound is conducted in Norristown. And just to give a little bit of context for those who may not be super familiar with Montgomery County, Norristown is pretty close to Philadelphia, maybe a 15-minute drive, depending on where you're trying to get to. And it's only about like 6 miles outside of city limits. We have a population of about 35 individuals, not 35, excuse me, 35,000, of course. And Norristown is our hotspot for overdoses. So many of our overdose prevention efforts do take place in Norristown based upon the need that is there. So Operation Rebound started in October of 2020, and it is a diversionary program that is a partnership between Montgomery County's Office of Drug and Alcohol, Norristown's Police Office, and Gaudensia. And as a diversionary program, of course, we don't want to arrest our way out of this. We want to connect people to treatment so that they can receive the help that is needed. So this is an outreach-based program. And the main players in this are the police officers and the certified recovery specialist workers that they partner with. And there are two main kinds of outreach that takes place within this program. One is the active outreach, which somewhat explains itself, but in active outreach, either the CRS worker and police officer are linking with a overdose survivor, which is identified by the police officer, or they are going into areas of the Norristown city where it is known that there is high drug use activity. The other option is self-referral. If a police officer is out and encounters an individual that they think is appropriate for this program, they can refer directly to Gaudensia. Next slide, please. So what they have pretty much accomplished thus far, 38 officers have been trained in this program. They have 2 certified recovery specialists working within this program. I believe they're trying to add more. There have been 115 individuals that have been referred and admitted to treatment year to date, and there have been over 250 contacts made with individuals within opioid use disorder. So I will turn it over to James to talk a little bit more about the specifics of the program. And next slide, please.
Hi, my name is James Harold. Thank you. I'm the program director of Montgomery County Outpatient and Operation Rebound. As you see, the outreach locations that we have, that we run through, that we go into and get individuals that are either on drugs, selling drugs, and try to get them into treatment here. CRS and the Norristown Police go out on 3 days together, and the other 2 days, CRS go out on his own as an outreach, and they cover these same specific spots every day. You know, we also get calls from the hospital for warm handoffs of the people that are overdosed that we have missed, or the ones that are overdosed in the presence of the police officer and the CRS, that we follow them up to after they get cleared medically, and we try to get them into outpatient treatment, inpatient treatment, detoxes, and when they complete that there, they'll come in for outpatient here. It's been pretty much fun helping people, and this is what we do. Thank you.
Thank you very much to all of the county presentations. All right, Pam, I think some questions have come in, so I'll turn it over to you.
Yep. Hi, everybody. We do have a couple of questions. The first one I think is going to be for Silvana. Can you speak to a little bit about how we can engage in conversations with individuals about fentanyl testing strips?
Yes, sorry about that. I think that there are a lot of concerns around fentanyl test strips, but they are really an amazing opportunity for a few reasons. And you know, one of the concerns was people are already using fentanyl or possibly searching for it. So might this convince people to use more of it? I personally, after all of our surveys, focus groups, and just personal discussions with people and the work that our health department did over the last few years, you know, there are some people that are seeking out fentanyl, but for the most part, they're using it because this is what has happened to the substance use supply. Like fentanyl has adulterated the heroin supply and is now in pressed pills. So we know that fentanyl test strips will not change people's use. They will not stop people from using fentanyl. What they will do is raise awareness of people's risk. And it gives you the opportunity to have an honest conversation about risk. And if we're not, you know, telling people to stop, I mean, obviously we're offering them other services. We're also not judging them, and we're making it possible to keep having more discussions. We find that people ask for other things when we have these discussions. The biggest opportunity, however, with fentanyl test strip distribution is the opportunity to reach people who are not using opioids as far as they know. And so as was referenced in some of the other speakers' discussions, we have people that think that they are just buying stimulants or K2 or other substances. They're not specifically looking for heroin or fentanyl. And then they get it and they overdose. And they know something is wrong, but they're not quite sure because it doesn't make sense. And so having this discussion and showing them how to use these test strips, we find that people come back and say, you were right. I had no idea. I do need Narcan, or I need more Narcan than what you gave me the last time. So I think that is the biggest value.
Thanks, Silvana. And then a couple questions for Joelle and or Talia. Can you remind us what the funding source is that's funding Finally Home?
So we are funded through the SOAR funds, the state opioid response funds, SOAR 2. So that's what we are funded through. I'm pretty sure that's all the funding that you use, right, Talia?
I believe so, yes.
Yep, that's it. So it's the state opioid response.
Thank you. And then I think you mentioned this, Talia, but can you speak to our individuals able to be on MAT if enrolled in the program?
Yes, so most of our participants are enrolled in MAT programs, whether it's methadone, Suboxone. We have some folks that are on the Sublocade shot or the Vivitrol shot. So yes, you are absolutely able to be enrolled or participating in MAT, but it's not a requirement.
Thank you. And then one final question for Finally Home. I think you mentioned this, Joelle, but probation officers are aware of the program and they are submitting referrals.
So I don't know if probation officers are aware of the program. We do work with the treatment court, so they're aware over there. I haven't actually reached out to probation. I've reached out to parole, state parole. They have their own program that they enroll their individuals in. But actually, it's a good idea. I might actually reach out to probation and see if we can work with them. But we do work with treatment court.
Great, thank you. And I think that wraps up our questions.
I'll urge anybody who is listening that want to add another question to the chat room. We have just 3 minutes left, but we can do it. So please feel free to enter questions in the chat room. I'll take this opportunity to provide some thank yous while we're watching the chat room. Thanks to our OPC leadership group. This is the group who really do all the heavy lifting for the coalition, and I thank you all. And really a very special thank you to Morgan Purcell. who, thanks to our Vital Strategies grant, is able to provide us with part-time staffing for our ROPC harm reduction efforts. I think many of you probably know her because she's been providing technical assistance and other support to suburban counties on the harm reduction efforts. Thanks to everybody on the call for their advocacy work and attention that you provide to people who are affected by substance use disorder.